Welcome everybody to our webinar today, the Introduction to Physiotherapy at St George's University of London. My name is Lanisha. I'm the Events Officer at St George's and I'm going to be your host for today. So the format of the event today will be a presentation from Sarah Waygood, and then we will also hear from a current student on the course about life at St George's. And then we will end off this webinar with a Q&A session. Okay, so for this event, we can't hear you or see you, but there is a chat box in your corner. So if you have any questions, please type them in the chat box, and we will endeavour to answer as many questions as we can in the Q&A session. Any questions that we're unable to answer today, we will email out responses to all attendees. If for whatever reason the webinar, my end, cuts out, or I cut out rather, I will try to come back in as soon as possible. So please just hold fire while I try to log back in. In the unlikely event that I'm unable to log back in, one of my colleagues shall take over the webinar. If your side cuts out, please just try to log back in. We will still be here, continuing on as normal. If for whatever reason you're unable to log back in, this session will be recorded and all attendees will get a copy of the recording in an email tomorrow. So you will be able to see the remaining segment of the webinar if you're not able to get back in. At the end of this webinar, there will be a survey that will pop up on your screen. I'll be very grateful if you could take out a couple of minutes just to leave your feedback so that we can work out any kinks or whatever as needed. Okay, so I will now welcome on Sarah Waygood, who will deliver a presentation to you all.
Hello, good afternoon, and a virtual welcome to you all. It's lovely to be here. Of course, this is a little bit different to how we would normally be doing things, but we are persevering and we are adjusting, and I think we're doing a reasonably good job of it. So, hoping this all looks okay to you. I'm just going to take you through a presentation. It's exactly the same sort of thing, information that we'd share on an open day, but obviously we're going to be going through this remotely. And as Lanisha said, then please do post any questions as we're going through. My name is Sarah Waygood and I am a physiotherapist by background. I've worked in a number of different big teaching hospitals across London, and I came to St George's Hospital in 2007 it was now, and then made my way into lecturing at St George's University part-time, and now do that full-time. And I also lead on admissions for physiotherapy program as well. So St George's is an institution I'm really, really proud of. I love working here. I love working with all of our physiotherapists of the future. It's a place that's always building, always developing, always coming up with new ideas. Lots and lots of strengths to our program and our institution that I will take you through in a minute. You know, in terms of our kind of reputation in the field of healthcare education, we are the UK's only specialist healthcare university, and that's something that we're really, really proud of. So this is just a little bit of an outline of the information that I will take you through. We're going to talk about our physiotherapists and what a St George's physiotherapist looks like and how we kind of get you to that point. I'm going to give you an overview of the programme and how it's structured and what you could expect to study if you were to enrol in our BSc Physio Honours programme, and think about some of the main themes that our students learn about. I'm going to tell you about technology enhanced learning, and then lectures and tutorials, practical teaching, practice education, all these elements of our teaching and learning that really make us who we are. And of course, we'll be having to do a nod to how these things have changed a little bit in the COVID era. It was Halloween in the COVID era, but also how things have not changed, because you know we're trying to continue to provide you know the excellent levels of teaching and learning as we've always done, and we are succeeding with that. And I'm going to talk to you a little bit about professionalism as well. Nobody likes to talk about exams. You don't want to enroll into a university and think about studying to become a professional, but we do have to assess you along the way, and I'm going to give you some reasons why you might choose St George's as the institution. that is number one for you. So what can St George's offer you in terms of being a graduate of our physiotherapy degree programme? Well, we talk about something that we call a transformative education, taking you as kind of like, I suppose, a raw ingredient and equipping you, if you like, with the knowledge and the skills to become a really excellent practitioner. And our graduates who are 100% employable, and by that I mean all of our graduates who apply for newly qualified physiotherapy jobs when they finish the programme are in jobs within 6 months of them completing. That doesn't include those who go on and do further study or who perhaps take time out. Some of our students start families once they've finished, or they go off and embark on slightly different careers. But all of those who want to are employed as physiotherapists within 6 months of them finishing. So our graduates are, in the words that we use to describe them, often confident and, really important these days, resilient. And they're people who are ready to work with colleagues, with patients, to provide really excellent care. Our graduates are people who are very compassionate and, importantly, again, now more than ever, equipped to adapt to changing healthcare environments. So our physiotherapists are ready to work in hospitals, in outpatient clinics, in community settings, in private practice, in the NHS, the charities, all sorts, all the different places that physiotherapists work. Our physiotherapy graduates are ready to go and work in those settings. We like to think, we hope, that our graduates are people who consider not just the physical ailment, so not just thinking about illness and injury as a physical thing, but also about the psychological, cultural and social elements that add into somebody's well-being and health. They're very powerful elements, actually. You know, a physiotherapist can work incredibly hard on someone's physical being, but if emotionally, you know, they're lacking confidence, or they are in pain, which is has a large psychological element to it as well as physical, then that person isn't going to do so well with their recovery. So we have our physiotherapy students really thinking about that from the very beginning, from the very minute they start their training. It's not just about the physical, although in other countries we're known as physical therapists, not just about the physical, but all of the other elements that kind of interweave in that as well. And that's something that you know, we use as part of our transformative education. So we've got, you know, you as the kind of raw ingredient. You go through your 3 years with us, we transform you into this wonderfully, even more caring, resilient, smart and professional practitioner. We use something called values-based recruitment, and I'll tell you a little bit more about that later. But basically, when we're recruiting students to our program, we're not looking for knowledge, we're not looking for skills. You know, we don't expect you to know what being a physiotherapist necessarily means, but we do look for whether you've got the right values and attributes of somebody who's going to be an excellent healthcare professional. And from research, we know what those values are. We have interdisciplinary training as part of our program. We are part of a medical school and a school that has a lot of other healthcare professions training within it, all the way from, of course, medicine, occupational therapy, radiography, paramedic science, healthcare science, and biomedical science. We've got the kind of patient-facing type courses and the more scientific-based courses. And we do a lot of teaching together, because although we're all healthcare professionals, you know, in it for the person, the patient at the centre of our care, we're all approaching things from a slightly different angle. And it's really important to understand those differences. And it really helps with, you know, working with those other different professions when you go out into the world of work and you get your first job. And because we recruit to values and we think about working together with people from different healthcare kind of backgrounds and with different healthcare focuses, we make sure that our graduates have the right skills and values on the other end as well. So we take those values, we mold them, we transform them, we give you the knowledge and skills. You don't just give it, you have to work for it. We help you along with learning and fostering in you that knowledge and more skills. We do a lot of work looking at team working, because it's incredibly important, so that you can ultimately provide really, really excellent patient care. So what does our program look like? I always say we're basically going to give you all the skills and all the knowledge that you need to be an excellent physio. That's kind of where I was going with that last slide, but this gives you a little bit of an overview in a bit more detail of what things look like. So you can see here the first, second and third years and the names of the modules. So in the first year, really what we're doing is kind of setting up the foundations for you. We're teaching you and you're learning the really key and core physiotherapy assessment and treatment skills. So the assessment here is in this one, principles of physiotherapy assessment, and then the treatment is here thinking about where things can go wrong, pathologies, and then health promotion and rehabilitation. And threaded through all of those are what we call essentials and factors influencing professional practice. So essentials is a lot of foundation level anatomy, physiology, and pathology, which then links into the more specific stuff that we do around physiotherapy application. And then, of course, the elements of professional practice. So thinking about communication, professional behaviour, team working, things like ethics and morals, and also the skills of being able to reflect and think about what you're doing and why. In the second year, we take what we've learnt or what you've learnt in the kind of core and foundation level knowledge and skills, and we build on that within these kind of specialist areas. So you take your kind of basic, I'm not sure basic's the right word, core respiratory assessment techniques, and we build on that, thinking about really much more complex patients or people who present with respiratory problems, for example, in that cardiorespiratory module. Then, of course, the musculoskeletal physiotherapy module, which is, I suppose, mirrors a lot of what most people think physiotherapists do. So, you know, working with people who have pain, back pain, knee pain, injuries. So again, we build on what you've learned in the first year and think about that in a more kind of complex scenario. And the same with neurological physiotherapy. So we're thinking about people who perhaps present with stroke or another complex kind of neurological disorder, and there are lots. And physiotherapists often work in those sorts of settings. We also think about the importance of evaluation and research. And this is introduced a little bit in the first year, but again, we build on this. Physio is an evidence-based profession. So we not only kind of stress the importance of using research and science to kind of, you know, inform what we do as physiotherapists, but we also introduce to you the importance of physiotherapists undertaking their own research. I'm going to come back to placements in a minute. In the final year, we move into a module called complex management, which kind of throws at you an incredibly complex set of cases. And you think about putting all of these things, all the cardiorespiratory, musculoskeletal and neurological, all things together, and perhaps using skills from those different specialist areas in one person, in one patient, because that is often how it looks in practice. We continue to develop your own professionalism, and the personalised professional development module is an opportunity for students to select an area of practice which perhaps is more specialist, and they can go on and kind of develop their knowledge within that. And our students undertake a research project as well. I'll come on to placements in a later slide, and just a nod to these kind of sections here. These are the kind of the professional knowledge and the professional skills are kind of the really key elements that really interweave throughout all three of our years of study. So we are really proud of the various methods of teaching that we use. So it's not just you rocking up, sitting in a lecture theatre being lectured at, and there are some lectures, and of course this year we are delivering them online, either live, a bit like this webinar style, although our students are able to interact with us during the session as well, or it might be it's a pre-recorded lecture which students then log in and watch, and then often there's a task kind of involved with that. We are still carrying on with our practical classes in our dedicated lab space, and you can see some pictures here. This one top right, that's in one of our labs. And we're using full precautions and personal protective equipment with our students so that we're able to work safely. Because really practical learning and and learning by doing is really, really key and fundamental to the style of learning on the programme that we use. And so we are carrying on with that. We do have access to a dissection room usually. We're not using it this year, unfortunately, but we're hoping that will be reinstated for 2021 and beyond. So our students learn their anatomy on cadavers, on actual bodies, and it really is the best way to learn anatomy when you can see it in situ. We use case-based and problem-based learning, so thinking about, we'll present students with a case of, a kind of theoretical or sometimes based on real life case of a problem patient or a challenging presentation, and we have students talk through what they think is going on and think about the skills that they might use in that situation. We have service users involved, so people who have got, who've had a stroke or have got Parkinson's disease or respiratory disease who come in, or at the moment remotely, and talk about their experiences. And our students really value this because they get to ask questions, in a setting where they're not being assessed, and that's really invaluable for them. And of course, again, as part of the medical school, we've got access to a load of simulation suites where we can immerse our students in their learning on that sort of, tech, if you like. Just a little nod very quickly to our technology enhanced learning. As I mentioned, we are working remotely at the moment, and we've got a virtual learning environment which is called Canvas, which means our students have access 24/7 to all of the materials that they need. And all of our lectures are recorded and uploaded by this thing called Panopto, so they can go back and watch sessions again that they either have missed or they want to go and review some information. We use something called Mentimeter, and some of my colleagues use Kahoot, where you can kind of engage with question and answer within sessions. And our library is extensive and has lots and lots of electronic versions of books, so you don't even have to come to the library to be able to take a book out. You can download a book and read it on your device. Or if you like an old-fashioned book, then of course we've got an extensive physical library as well. Just want to give you a sample of what a week might look like for you as a future student physiotherapist. And this is the first year. This is next week for my first years. So you can see on Monday, they've got practical labs pretty much all day. It's a busy day. We give them a nice long lunch so they can go and get themselves a nice hearty lunch from Pret. Be takeaway though, going forward. And then you can see they've got lectures on Tuesday morning, and then they're in a dissecting room session, which I think is remote in the afternoon. Wednesday afternoons are always protected for sports and other activities, and our students are really encouraged to engage with extracurricular activities via the Students' Union. And then you can see they've got more sessions on Thursday and Friday. Being a physiotherapy student is a full-time job. That's before you're out on placement. But that said, we do have students who are parents and have other caring responsibilities. We do have students who work part-time. So it is possible to juggle those things, but you can expect to be pretty much full-time and full on. And the next slide is just another example of the second years. So our second years, you can see, again, it's full-time. They've got Thursdays for their own practice. So there's no structured teaching on that day there. That's next week. No structured teaching for them, but they are encouraged to come in and practice the skills because they've got an exam coming up in December. So they'll be there in the labs with their PPE on, practicing for their exam. Clinical placements are arranged by our dedicated placements team. And the idea is that our graduates, when they finish the programme, have had a kind of variety of experiences. There are 5 placements, each 6 weeks long across second and third year. There's no placements in the first year. And students average about 30 hours a week. Now in the UK, there's no requirement for a certain number of hours in order to register to practice with the Health and Care Professions Council. Although we do say you would receive around 1,000 hours of practice related experience, but some of that will be given in the university as well. If you're somebody who is looking to attend from another country and you're thinking about going and registering to practice in your own country when you're done, and your country or your state has a particular requirement for the number of hours, then we can work with you to make sure that you're able to achieve those. I think in Canada it's something like 1,100 or 1,200 hours, and we are able to work with students to make sure that they can achieve that so they can register to practice. There's just some pictures there of some of the local placement providers. They're different hospitals and communities, but we also have placements across a bunch of different areas, and there's going to be a post-it note that comes up just in a minute. Ping, as if by magic. There you go. There's all the different areas of speciality. I say all, it's most, there are others, but those are the different areas in which physiotherapists work. So you might find yourself in all, or not all, there's only 5 placements, right? But a number of them, and yeah, loads of different ones. Some that are more kind of traditional, and some that perhaps, some people wouldn't even realise that physiotherapists work in perhaps mental health or women's health, for example. So loads of different opportunities available. Oh, sorry, I think I covered those last 2 things there. Oh no, that's important. Physiotherapy students are currently included in a list of key workers. So we don't know exactly what's going to be happening kind of this time next year, but our physio students are covered, when they're going out on placement in COVID times, they are covered as a key worker. So, if you're a parent and you need to access childcare because you're on placement, then that would all, you're considered as important as a physio student. You're considered as important as any other person working in health at the moment. So I said I'd mention assessments, and again, something that we try and do with a lot of variety, because nobody really enjoys exams. If you do, then yeah, that's good for you. We do have exams which are being done online. Actually, we were doing them online before we were doing lots of working from home and limiting groups of people together. We have written and multiple choice exams that are done through our virtual learning environment. And of course, we have coursework. It's really important to be able to write in an academic style and communicate succinctly and be able to write professionally. And so, of course, we have coursework. We also have practical exams. In the first year, we have something called an OSPE, the Objective Structured Practical Exam, where you're given a task and asked to demonstrate your knowledge and skills. And in the second year, it becomes more interactive. So while you're doing it, we're asking you questions and asking you to justify why you're doing things. So it gets a little bit trickier. We're also really, really fond of the presentation. And I think for a lot of people, being able to kind of vocalize their thoughts and ideas is something that they prefer to do rather than writing it down. It's not for everyone. So there are platform presentations kind of like this. Again, we do them online, or in groups to produce a poster and present the findings of a particular piece of research or investigation on a poster. And we do Vivas. Now, Vivas sounds scary, but again, it's you having a conversation with an assessor and them asking you questions around what it is you're talking about. Our students do a lot of reflective work, and as I mentioned before, we want you to write about experience that you've had and thinking about how that has impacted you and changed the way that you think and the way that you behave in practice. And we don't have a dissertation. I don't know, for those of you who are doing research on being at university, lots of programs have a dissertation where you have to write thousands and thousands of words. But instead, we have physio students in small groups who conduct a piece of research and write it up ready for publication. So it's a lot less words, but it is a full-on research project in terms of the carrying out. So some really, really good skills to be learned there. Okay, hopefully you're sold and you're thinking, this sounds amazing, Sarah. I absolutely want to come and study physiotherapy at St George's. How do I get in? So here we go. We've got the kind of 3-tier system of entry requirements, and the first one is academic. This is a very brief overview of our academic requirements, and there are more details on our website. And of course, if you want to ask a specific question about your own specific study, then there are ways for you to ask that as well. But we're looking for the equivalent of 3 A levels at ABB. I put there to BCC because we do have a program by which students who meet certain, or applicants who meet certain criteria may have their offer lower. So again, if you want more information about that, it is on the website. It's really important that you have maths, science and English GCSE grade 4 or equivalent, but we do accept a variety of different qualifications, provided they meet that whatever is equivalent to A levels of ABB. We don't ask for any particular subjects, so if you don't have A levels in science or you haven't previously studied science, then that is not a barrier. And for about 5 or 6 years now, we haven't had a requirement for things like A-level biology, and we have never, or not yet, had a student who hasn't been successful because of that. Yes, those who don't have a science background report that they feel like they're working a little bit harder to play catch up perhaps sometimes, although not always. But we're going to teach you all of that, all of the science that you need to be a physio. And to be frank, A-level biology is plants, so I'm not even sure how that's relevant. On to the non-academic requirements. So we do read your personal statements, and what we're looking for is that you're committed to a career in physiotherapy. So ideally, we want to read that you've done your research and a physio is what you want to be. Now, sometimes people are a little undecided, and we might contact you to kind of have a chat with you about that. But we'd also tease that out of you at interview as well. But ideally, we'd like you to really commit to the profession. We also want you to have a really good understanding of what it means to be a physio. It's not just treating sports injuries. You know, there's lots of working with older people and in all those different settings that I've kind of previously referred to. We want you to have had some relevant work experience and to be able to talk about that in your personal statement. Now, it's really difficult to get physio work experience anyway, and even more so with COVID, because hospitals are not allowing, you know, anyone outside of whoever's necessary into their settings. So reflect on the experiences that you have had, anything where you've demonstrated teamwork, where you've demonstrated responsibility or creativity. Even if, you know, you've been a coach for a sports team, or you've looked after children, be they on your sports team or relatives. Reflect on any experience that you've had in COVID times. You know, were you involved in collecting donations to go to a food bank on your street? And what skills does that show that you have? That's what we want to be reading about in your personal statement. All of our students or to enroll also have to go through a police and health check. So when you're applying, if you're asked to provide information for those things, then do so in as much detail as you can and whatever's required of you. And then lastly, provided you meet our academic and non-academic entry requirements, we will invite you for video. And we do something called a multiple mini interview. And we're doing this remotely by video this year. Applicants are sent the questions and then are given a 3-hour window to record a video of them answering the questions and upload it to a shared drive, which are then assessed by 6 or 7 individual assessors. So with a face-to-face MMI, you go from booth to booth to booth, and each assessor asks you a question and marks you based on that question. So we're trying as best we can to kind of reproduce that, but remotely. So you submit a video of you answering the question, and then each of those questions is assessed by the different assessors, very much like it would be in kind of the face-to-face real-life scenario. You're given a score for your interview overall, and if you meet our required score for that year, then you are made an offer. It's as easy as that. So just lastly, and I'm sorry, I have gone on a little bit, why would you choose SGUL? Well, as I said, we're the only UK specialist health university. We're not the biggest of universities, but we are very specialist. And we're very proud of the fact that we have this excellent relationship with our students in cohorts that do not run into the hundreds of thousands. We are top for graduate prospects. That's from 2018. I think we still are. This is a little bit skewed because, of course, all of our graduates have got professions once they leave. So, of course, we hope that they're going to go and get jobs. But still, we're very, very proud of that. And we're in the top 200 for the Times Higher Education World University Rankings, which top 200 doesn't sound that impressive, but when you think of how many universities there are in the world, it is quite impressive, and we're really, really proud of that. We've been awarded Guardian University Award for Teaching Excellence. So, you know, the people who will teach you are professionals. You know, my colleagues are either previously practicing or currently practicing physiotherapists, but also with qualifications in teaching. So we all do postgraduate certificates in teaching and learning, and I went on to do a master's. So we're very, very passionate about different methods of teaching and making sure that our students are getting really excellent learning experiences. We are number 5, I think, or we certainly were, in the top UK universities to study physio. I'm not going to tell you who's above us, but we're really, really proud of that, because again, there's a lot of places you could choose to go and study physio, but we are top 5. And of course, one of our big selling points is that we're part of St George's Hospital. So our students rock up to their university to do their learning at a hospital. It's just like going to work when you're qualified, you know, and having that interaction with real life patients and experiencing, you know, a healthcare environment from the day you start your learning is something that not all physiotherapy students get. So a really, really excellent experience and opportunity. There are other experiences and opportunities for our students once they're enrolled, and I will let my lovely physio student, who's in this picture here, there he is, I'll let him tell you a little bit more about that. And then lastly, I hope I've kind of inferred this already, and I realised I'm not sure I like the word produce, because that sounds like it's us doing all of the work, and it's not. Our students do all the work, but our graduates are great physiotherapists, and they thrive in their careers, and we're incredibly proud of them. They go off to work in lots of different specialities in lots of different areas, and they always come back to us. They like to keep in touch. And I'd like to think that that's because we've along the way helped them to have a really, really excellent experience. So if you've got any questions, chuck them in there. I'm happy to answer them. But I hope that's given you a load of information, and you are feeling really positive and enthusiastic about applying to study physio at St George's. And thank you for listening.
Thank you very much, Sarah. So now I'm going to invite Garrett on the screen. He's one of our current physiotherapy students, and he's going to spend a little bit of time talking to you about life as a student at St George's. Hi, Garrett.
Hi there. Just go on to the next slide, that'd be great. Cheers. All right, so firstly, hello. Welcome to, I would say, St. George's, and I hope everyone is staying safe and everyone's doing well in these trying times. I'm really glad that you are here and that you are really considering a spot or considering to apply here at St. George's. I think Sarah has given you a lot of the academic side and you know what all the nitty-gritties that you have to do. But if you allow me the next 5-10 minutes to actually go through with you what I've experienced in my last 3 years of going into my 3rd year of physiotherapy here at St. George's. So George's is a really small community. We are the UK's only health or medical related university. So the bond and the camaraderie, I would say, is really, really tight, and everybody is really close knit. George's is a place of opportunity, I would like to say, and in my time here, I have had countless opportunities to improve myself or do things which not many other physiotherapy students or any other students in other universities get to. For example, in all of the pictures that you can see on the presentation, these are just but a few things which I was able to participate in. Where do I begin? George's really has something for everybody. If you like sport, for example, there are almost 100 over different clubs and societies that you can choose from. If you would like to go into a particular field, for example, I personally like anatomy, dissection, or even cardiorespiratory, for example. You know, George's has societies for that as well. And if you look in the bottom right-hand corner, there's me in a full set of surgical gowns as well as masks. That was actually the summer dissection course, which Sarah talked about a bit, how you're able to go into DR and doing, you know, your anatomy in situ. that's basically that course is actually preparing the cadavers for you guys to learn and all that. So if you're interested in that, that's a really unique experience, because there's not, I would say, so far there's only Georges is the only university I know of that actually provides that. Besides that, Georges has a lot of extra widening opportunities for its students. For example, I'm a student ambassador of the university, and a lot of the time we do programs or talks with different kinds of institutions as well as schools. If I could bring attention to the bottom left corner, for example, I spent I would say 1 or 2 months with a primary school called Primary Practices, a program run by university, and we basically taught students or younger kids on medical related teachings as well as information, so as to widen and broaden their understanding. And it's really fruitful. I mean, I met one of my, I would say, ex-students in I would say, I think it was Sainsbury's the other day, and I asked how she was and all that, and I said, do you have a better understanding of what we do and what medical professions do? And she was like, yeah. And she told me that she wants to be a physio when she grows up, and that really warmed my heart, because I knew that I made an impact in somebody's life, and these are kids who have just, honestly has a whole life ahead of them. But honestly, one thing that I'm really proud about is Georges trains you to be a professional, and I think that is paramount to a lot of other different things, because at the end of the day, we train to be physiotherapists, we train to be medical professionals, and I think Georges does that the best. You're in a hospital environment, you're working with professionals who are, I would say, at the best time or the best place to show you how things are done. You work with students from various other backgrounds. You have medicine, you have occupational therapy, you have radiography, you have midwifery, paramedics, and the list goes on. So you really see how the whole team works together for the patient, as the NHS is going to what we call a MDT, or a multidisciplinary type of practice. So yeah, it's honestly been a really, really cool 3 years. And if you have any other questions pertaining to the life as a student, you can always ask me towards at the Q&A session. But I think the time I spent at Georges has really opened my eyes to the various opportunities and the improvements and self-improvements that you can do, that you can make as a student. One of the staff members, I will never forget, at the start of my first year actually told me this, and he said that because we are in a hospital, because the university is basically the hospital, you are probably 20 or 50 meters away from somebody who needs your help, or somebody who has lost unfortunately has lost a mother or father, sister, brother, uncle, and and these are people that you will be treating, and these are people that genuinely need your help. And if that's not a good enough reason for you to work hard and be the best person that you can, then it really makes you reevaluate yourself as and why you're doing this profession and why you're applying. So I think when Sarah mentioned about the value-based system, that's really true. We can always teach you the information, we can always guide you with what you need to know as a physiotherapist, but at the end of the day, knowing and going into the practice for the correct reason, I think that's something which everybody needs to ask themselves. But one thing that I can guarantee you is that if you come to Georges, you will not be less off, or if not, you'll probably be better set to work with real cases, to work with patients for the betterment of the patients. So hopefully that was a really quick whistle-stop tour, as I know we are running a bit behind on time, but I'm more than happy to answer any questions that you might have pertaining to the life at Georges, or some of the other extracurricular things that we do offer at the university. So thank you very much, and I hope to see you guys at one point in time, or when we're able to see get face to face again. So thank you.
Thank you very much, Garrett. That was great. So now it's time for our Q&A, and we have had quite a few questions sent in. Gonna ask Sarah to join us back on the screen, and so we can direct these questions to both yourself and to Garrett Perfect. Hi, Sarah. Thank you for joining us again. So we've got a few questions to get through. So if you bear with us, we will get to your questions. So we have one here. How many people apply for the course compared to how many are accepted?
Oh, that is an interesting question. I mean,
Sarah.
I often get asked that, and I wonder why. I think people are trying to measure, what are my chances? We get something in the region of it does vary, but probably looking at about 500 or 600 applications a year. We'll interview maybe 200, 250, and then we'll make somewhere in the region of 150 offers for 65 places.
Perfect. Okay.
But anybody who applies who meets our requirements will get made an offer for an interview. So if we have 600 applications and all of them have got the right, qualifications and their personal statements, meet up to our requirements, they'll be offered an interview.
Okay, great. Thank you, Sarah. And somebody asked for clarification of the application deadline.
Help me out. January 31st?
January the 15th.
15th.
15th of January, yes.
Christmas
Yeah.
break's always a really good time to get your application sorted and in, I think.
Yes. Okay, we've got another question here. Are extracurricular activities an important factor when it comes to accepting students?
If that's if you're asking, do I need to sign up to a football club to write about it in my personal statement to get made an offer for an interview? No. The stereotype physiotherapist is really sporty and fit, and that is just the stereotype. Doing things outside of school give you experiences to write about and to kind of demonstrate other skills outside of your kind of academic prowess. But if you're not already doing it, don't feel like you have to go and bust your chops to, be filling your days and evenings. You could reflect on something you've seen on television or a podcast that you've listened to. If you're not somebody who wants to go out in the cold and be kicking around a football, but you're somebody who likes to read or listen to things or watch stuff on television, as long as you can reflect on what you've learned and how that experience relates to physio, then that's brilliant.
Okay, sorry, go on, Garrett.
If I could add on there, I think the lecturers and the admissions tutors are not, looking for stellar. I'm gonna choose my words correctly, but they're not looking for you 5 different major hospitals that you've been to, and you've been to trauma, you've been to MSK, and all of that stuff. Honestly, they're looking for the right fit. And I think at the end of the day, as long as you show that you have compassion and you have the right, it's to be honest, the information always teach you that. But at the end of the day, if you're not motivated or you don't have the correct set of values in order to be a healthcare professional in general, then it's very difficult to progress, I would say, throughout the course. So you don't necessarily think that I have to have 1,001 different extracurricular things. What I thought at first, but when I actually did the interview and when I went through the process and speaking to Sarah and the rest, they honestly genuinely want to see your motivation and the purpose why you're going into the course. And I think if you just tweak that and have that different mindset change, you can basically turn any kind of experience into that kind of motivation.
Thank you, Garrett. This is what I was going to say. I was going to say, let's talk a little bit more about experiences, because I've had a few people talk about the type of experiences they should get or how can they reflect on their experiences. So I kind of think what you said was very needed. Anything you want to add to that, Sarah?
Just if you have had an experience, I mean, you could list all of the different, like Garrett said, all of the different experience that you've had. You could list them as much as you like. But what I want to know about it is, what have you learned from that experience? What have you learned that's demonstrated that you've got good team working skills or communication skills or empathy? What have you learned about yourself? Did you go into an experience thinking, I think it's going to go this way, but then actually it was very surprising and it didn't go that way? And what have you learned about perhaps stereotypes or judging people before you've found out fully about it? And that could be an experience in a healthcare setting, or it could be an experience anywhere else. I don't know, imagine you're doing a group project at school or at college, and there's someone in the group and you think, oh gosh, this person does not work very hard. And then you find out something about them, which might be the reason why you perceive that they're not working as hard perhaps as anyone else. Perhaps they've got some, they've got to rush off and go and pick up their little brother or sister, or there's something. But what have you learned about that? What lesson did that teach you? And that's what we want to see you writing about in your personal statement, not just all of your experiences, but what those experiences demonstrate and how you have learned and grown as a person and as a healthcare professional of the future.
Perfect. Thank you, Sam.
We need to understand, or I think you guys have to understand that healthcare backgrounds, there is no set cookie system as to, yes, you have this. I mean, for example, I was in the military. That has nothing to do with healthcare, but it's my time in the military and time in the army. How do I apply that into the way I work as a healthcare professional in the future? How do I treat patients and all that? Teamwork, for example, is really big over there. And as well as taking initiative, being adaptable. These are universal truths. These are universal things that you can apply anywhere. So I can try and take these universal things from your experiences and put them in your personal statement and explain to the admissions tutors, yes, this is what I hope to achieve in my physiotherapy practice in the future.
Thank you very much. Somebody had a question about the Greek qualification requirements. We will consider qualifications from other places as long as they meet our requirements. We do have the entry requirements on our website, so you can check to see if we have the specific grade requirements there. If not, then please do email the inquiries team and they will be able to tell you the specific requirements for your qualification if it is from outside of the UK. We have someone that has asked Ahmed, if you're still with us. I think his question is basically saying, as a disabled potential student, will he still be able to get onto the course? Will his disability hinder him from getting onto the course?
I'm going to put myself out there and say no. We have had and we do have students with disabilities on a really wide spectrum. We had a student a few years ago who was a full-time wheelchair user. We've had students with visual impairments. We've got a couple at the moment with hearing impairments, one whose first language is sign language. We've got lots of students with learning disabilities, dyslexia, and students on the autism spectrum, all sorts. And yes, I'm not going to lie, sometimes it's challenging for us and sometimes it's challenging for our students, and often our students with disabilities have to work much harder than the students who don't. But there's incredible support for students. We have a dedicated disability officer as part of the university, and it's her job to kind of make sure that our students are being supported, and if they need like things written as part of what we call a summary of support needs, so measures are in place to make sure those students are supported by the university. And within our team as well, in our Centre for Allied Health, we have a dedicated one of our academics whose role it is as disability tutor to make sure they're providing the kind of more pastoral support as well for students with disabilities. And I think, of course, because we've so many students who have disabilities, be they seen or unseen, there's a really nice kind of cohort support as well for our students. And I hope we do support for students with disabilities well. We should. We're healthcare professionals. That was my job, was working with people who had disorders of breathing, movement. As I said, sometimes it is challenging, but it absolutely should not put you off from applying, and it absolutely will not affect your opportunities or your chances of being successful and enrolling on our program. But if you've got any more specific questions or you want some advice or reassurance, then please do go ahead and email our inquiries team. They can always pass your inquiry on to me directly.
Thank you, Sarah.
To be honest, I mean, I have some of the disability students on my course, and to be honest, they're doing really well. It's honestly, it's just like wow. And if anything, it's motivation to us as well, because it's like if they can do it, I can do it as well. So it's kind of like the whole, me supporting you and vice versa. And to be honest, it doesn't affect them at all. As long as you're able to put in the hard work and you're passionate about the course, you'll be fine. So honestly, apply, you'll be fine. Trust.
Thank you. Are all placements in the hospital, or are they in other places as well?
So I'll let Garrett answer that one.
So yes, because you're at university, and you are, correct me if I'm wrong, Sarah, but you can have places up to the end. So that's the entire range of placements that you have, and in London, hospitals,
Can you repeat that again, please? Because your connection was cutting out. Could you just repeat what you said again?
Oh, sorry. Can you hear me? You guys all right? Yeah. Okay. Yeah. So London, you can have placements till the M25. So you have placements in like big hospitals for like Guy's and St. Thomas. You have King's. You have Imperial's NHS, etc. But you also have community. You also have community hospitals. You have outpatient clinics as well. So there's a wide range of places that you can be placed. And to be honest, you don't need to go to a big teaching hospital in order to learn something. In fact, a lot of what my cohort mates found was that because they are at a community hospital, the pace is much slower. So they're able to learn more, they're able to question more, they're able to dig deeper into something that they're not very familiar with. So, you're not disadvantaged to say, oh, I'm at a big hospital as compared to somebody who's at outpatient MSK, for example. It's the matter of the attitude and what you bring into the placement.
Thank you.
I think the short answer to that question is no, your placements are not always at St. George's, and you can expect to never be placed in the same place twice. That would be very, so midwifery, for example, I think, and radiography programs, they're kind of allocated like to a team in a particular hospital, and they always do their clinical practice there. It's not the same for physio students, and this is true of all of the physio programs across the UK, not just St. George's. You will go into different practice sites.
Thank you. So I've had a few questions about applying as a mature student. Can you train as a mature student? What's the entry requirements as a mature student? I'm a mature student of 23 years old. Can I still apply?
That's not mature.
He's not mature. How is that mature? I'm 22 and I'm like, oh.
I know. So I often get emails from people saying, I want to apply, but I'm a mature student. And I'm like, yeah, brilliant. So the entry requirements are exactly the same, but of course we would consider whatever you're studying currently. So you need to have met our requirements within the last 5 years, and there's some caveats to that, and that's all on the website, or email if you've any particular queries. I don't know why, but St. George's seems to have really old, and it says 40, nearly 41, really old cohorts. So at the moment, the average age of our kind of across the 3 years, the first year are a little bit younger. I don't know why, but they are. But the average age across the 3 years is 25. So as a 23-year-old, you would not be considered all that old. Certainly not geriatric by any stretch. I think our oldest student at the moment is in their mid-late 40s. We did have a guy qualify a couple of years ago, aged 54. And of course, everyone was like, oh, you're only going to practice for 6 years and then you can retire. There is no age limit to this at all. And actually, physiotherapy is a profession that lots of people come to later in their life because they've experienced it. Physio and midwifery typically. People go into midwifery after they've been on the receiving end of a midwife. But, you know, and it's also a profession that we have school leavers into. So as I said, our current first year, we've had a lot of people come straight from school. But the sky's the limit when it comes to age. And again, as long as your entry requirements are meeting what we need, then yeah, nobody's interested in how old you are.
Perfect. Thank you. Conscious, we've got 5 minutes left. I'm going to get through as many of these as possible. If we are unable to answer your question, please rest assured that you will get an email from us within the next 2 days with a response to any remaining questions that are not answered in this Q&A, okay? Someone has a question about accommodation for those that apply for the course. So we do have a halls of residence at St George's, and all can apply, especially if in your first year. First years are given a preference when applying.
You're guaranteed in first year. That's my understanding.
Yes. So yeah, we do have a halls of residence, and it's about a steady 10-minute walk away from the university site where the lectures are held. So we do have halls of residence. There's more information about our accommodation online, and there's also, I believe, a kind of tour, a video that kind of tours some of our halls. So you should be able to see that on our website. How many chances do you get to pass your exams if you don't do so well the first time round?
We don't have a limit on the number of times you can do a resit. Some programs do, but we don't. So if you were to sit your A-levels this year and not meet our requirements, and next year you also didn't meet our requirements, but the following year you did, that's fine. If you are that committed, then you keep trying. You keep resitting. You keep trying to meet our requirements, yes, there's no limit to that. Just as we also don't have a limit on the number of times you can apply an interview. Again, some courses say you can only have, you can only try 2 consecutive years, and then you're not allowed to apply again. There's no limit on that. We did have a student a few years ago who was successful on their 6th attempt and did absolutely brilliantly, and was, sorry Garrett, one of my most favourite students ever. So no limit on that. You know, if you're committed to becoming a physiotherapist and you keep going, it shows resilience, it shows commitment, it shows perseverance, and those are values in healthcare professionals that we need. So kudos to you.
Perfect. What does the sports and activities include on Wednesdays? So I guess that's about the dedicated time. Do you want to answer that, Garrett?
Everything. Yeah, everything. So so sports obviously is you have all the clubs and societies, but you have, I didn't know we have a baking society until recently. So again, I've been here 3 years and I did not know that. So again, George's is full of surprises, and you can cater to everything. So if sports isn't your thing, you can go into arts. We have a lot of dance. Dance is a really big thing at George's. I think there's a music soc as well. Cultural, you have various different ones. If you're more into academia, then you have all of, let's say you have surgeries soc, you have cardio and respiratory, you have neuro, you have physio soc, obviously. There's basically a society for everything. And most of the time they have it on Wednesdays because that's protected time, like Sarah said, for students to explore their interests. So honestly, you're not short of anything. Yeah.
Thank you.
You can do whatever you want, really. Yeah.
Yeah, or you could just choose to, snooze, watch TV, hang out with your mates, study, practice.
Well, thank you very much, Garrett and Sarah. That's all we have time for today. So the unanswered questions, there are a few unanswered questions. As I said, you will get an email within the next 2 days with a response to all of those questions. Please do take a few minutes out to fill out our feedback survey, which will pop up at the end of this webinar. And I thank you all for joining us today, and I hope you got all the information you needed. Any questions still to ask, just do send us an email, and our team at St George's will be very happy to get back to you. We look forward to welcoming your applications in January. And yeah, take care and see you guys soon, hopefully. Thank you.
Take care, everybody. Stay safe. Bye-bye.